This week, healthcare was showing up all over the campaign trail as the November elections came into focus. Welcome to the August 21st edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Abby Mocktig.
And I'm Tim Nelson.
This week, Democrats and Republicans were talking healthcare around Minnesota as primary election winners turn their course toward November. U.S. Senator and DFL candidate for governor Amy Klobuchar toured hospitals across the state, with stops in Winona, Cloquet, and Detroit Lakes, all highlighting her healthcare policy proposals. Her top priorities are lowering out-of-pocket costs, protecting rural access to care, and expanding the state's healthcare workforce.
It's about fighting for people's health care, fighting for health care that fits your budget, that fits where you live, and that fits for you where you work.
Klobuchar also plans to create a state tax credit to offset skyrocketing healthcare premiums if Congress doesn't take action to extend the Affordable Care Act subsidies that lapsed last year.
If the feds aren't going to do it by the end of this year, I will do it as governor. And that's going to greatly help people afford their health care in Minnesota because so many are on the individual market.
GOP nominee and Minnesota House Speaker Lisa Demuth also discussed her health care agenda this week on the campaign trail. She touted accomplishments from last legislative session that directed additional funding to rural hospitals in the form of a Medicaid reimbursement rate increase and one-time funding.
Now we have to make sure that we are providing health care across the state, because when there is delayed treatment or delayed health care, people end up having either worse outcomes or they are sicker. So making sure that there is health care available across the state is a priority.
Republican House leadership did, however, scuttle a 340B drug discount bill that had rural hospital and bipartisan support in the final days of the session in May. Demuth called out the Affordable Care Act for driving up healthcare costs, along with a previous Minnesota law that provided state-funded healthcare to undocumented immigrants. A divided legislature voted last year to roll back those benefits for undocumented adults. A new poll this week from KSTP-TV and Survey USA said Klobuchar had a 16-point lead among likely voters heading into the November election.
Also, a new minimum wage for nursing home workers has won final federal approval and is now poised to take effect September 10th. The new rates include a $27 an hour wage for LPNs, $23.50 for medication aides, and $22.50 for certified nursing assistants. Other nursing home staffers will have a $19 an hour minimum wage. Those wages will also rise by another $1.50 an hour in January. The new wages were set by the state's Nursing Home Workforce Standards Board, created by the legislature in 2023, and the first such regulatory body in the country. The board has been the subject of a court challenge by nursing home operators who contend that it exceeds state authority and could force nursing homes to close even as the need for skilled nursing care grows. But a federal judge dismissed the court challenge to the board this week, clearing the way for new wages to take effect, although many workers are reportedly making more than the new minimum. Nursing home operators told the Minnesota Reformer that they are weighing an appeal. Also this week, yet another food-borne illness outbreak, this time traced to Minnesota-grown alfalfa sprouts. The Minnesota Department of Health says 23 people fell ill and 2 were hospitalized in an outbreak of both salmonella and Shiga toxin-producing E. coli. The outbreak has been linked to Everything Sprouts and Calco brands sold at Cub, Kowalski's, and Jerry's supermarkets and used at some restaurants. It follows a salmonella outbreak this summer linked to jalapeno peppers that sickened more than 100 Minnesotans, and more than 15,000 U.S. cases of cyclosporiasis linked to iceberg lettuce.
In Washington, U.S. Citizenship and Immigration Services issued new guidance this week, clarifying the Trump administration's so-called public charge policy. Ellen Florek has more.
The new policy rescinds 2022 regulations and gives immigration officers broader discretion to consider an applicant's use of means-tested public benefits, potentially including Medicaid, when determining whether an individual is likely to become a public charge. That could be a key factor in eligibility for green cards. Spouses, children, parents of immigrants, priority workers, investors, and U.S. Armed Forces personnel Among other specific groups are subject to public charge evaluations. Asylees, refugees, human trafficking victims, and special immigrant juveniles are not. The change could create a chilling effect on eligible immigrant families seeking Medicaid or CHIP coverage to access health care if they fear being a beneficiary might impact their application to stay in the U.S. The new regulation goes into effect on September 18th and could add to the already growing ranks of the uninsured in Minnesota and the U.S.
That's it for This Week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Abby Mocktig.
And I'm Tim Nelson.
Thanks for listening.